Hello all, welcome to my channel. Let's talk about cancer. In this video, we'll talk about cheek cancers. Cheek cancers are one of the most common cancers that we see in India. It's very high among women, but probably the most common among men. In our state of Karnataka, I see a lot of cheek cancers in both men and women, more among women, because they are taught to chew tobacco from a very young age. Now, years and years of keeping oral tobacco anywhere in the cheek, especially in the gap between the teeth and the cheek, it is called as the GB sulcus, causes exposure to tobacco which has cancer components, and over the years slowly this becomes cancer. It's not necessary that they need to be exposed for years. In some in as early as 6 months to 2 years, in some in about 10 years or 15 years, the chance of it becoming cancer are very high. If picked early, we can do a surgery removing only the cancer area along with some normal tissue, and along with this we'll have to clear some nodes in the neck and give back a beautiful form so that the impact of this cancer is not there on the patient. But most often, since it does not cause much pain or bleeding, patients try to control this by themselves by applying some local ointment or taking tablets, and by the time they reach people like us, the cancer is already spread into the bone or into the skin, requiring a massive resection which involves the skin, bone, and extensive clearance of the nodes from the neck. We are still able to do this in the current era with a good amount of aesthetics and give them good form of function, but if it can be picked early, it's always better. The chance of cure as well as of giving back a good aesthetic form is very high. Nevertheless, cheek cancers being so common are treated with a radical surgery which involves removal of the primary tumor, removal of the nodes in the neck, and some form of reconstruction to give a good shape. And after this, there is some amount of radiation which most patients require, and in some patients even some chemotherapy is required. Most patients tend to do well, especially if they're in the early stage. Even if it's third stage or early fourth stage, we are still able to give them a good outcome, except in really advanced tumors. There is a good treatment available for this. Many patients are doing well. In fact, you can't even make out that they have had the treatment. But if we can prevent consumption of oral tobacco or smoking, we can avoid this. And if we pick up something which is abnormal, if we go to our oncologist early, we can pick this up early, so the chance of cure are very, very high. Let's aim for that. Good day.